Hi, I'm Dr. Swathi Sunil Rao, consultant pediatrician and pediatric intensivist, currently working at KMC Hospital, Mangalore. So, what is a seizure? Seizure is a tightness of the muscles followed by jerky movements, or it can be a subtle signs like uprolling of the eyes or when the child becomes unconscious. When do you really worry about a seizure? Seizures can happen due to mild problems like high fever, or seizures can happen due to a serious illness like a brain tumor or infection in the brain. So, when do you really worry about the seizure, and what do you do if a child has seizures in the house? First thing is take the child to a safe place. So, what can happen is suddenly the child can lose consciousness and fall. So, make sure if the child falls, the child should not get injured. So, put the child in a recovery position, that is usually left lateral position. What happens is when the child is having seizure, the tone of your oropharyngeal muscles can become less and the child can aspirate whatever the contents of the stomach is. So better to put the child in the left lateral position so that the child doesn't aspirate on the food contents. So more than doing things, there are few things which you should not do when the child is having fever. Trying to put things in the mouth of the child like water, or some people believe that giving a metallic object in the hands of the child will reduce the seizure. That is a wrong thing to do. If most of the children, the seizure comes down within 5 minutes. So wait for the child to abort the seizure on its own. If the child is not aborting the seizure on its own and child is has seizing for more than 5 to 10 minutes, then might be you have to rush the child to the hospital. So the reason for seeking medical attention is if the child is having recurrent seizures, especially more than 5 to 6 times a day or continues beyond 10 to 15 minutes, the child can have brain damage, especially due to recurrent electrical activity of the brain and hypoxia induced by the airway obstruction. So what happens is when your child is continuously seizing, the child loses consciousness and the tongue and the airway structures lose their tone and can cause airway collapse, and the oxygen will not be going into the child's lungs. So that can lead to hypoxic damage to the brain. So all seizures is not a lifelong condition. So we don't term the children who have seizures into epilepsy. So epilepsy syndromes are the ones which can last lifelong and might require lifelong treatment. So whether your child's seizure is a temporary one or a permanent one depends on the etiology or the cause for the seizure. If the cause for the seizure is just gentle fluctuations in the fever, which we called as febrile seizure, usually it will never last, definitely will not last beyond 6 years of age and does not require permanent treatment. But if your child's seizure is because of the damage in the brain, especially during the newborn period, or is it because of a scarring in the brain because of an infection, or it's because of a tumor, the child's seizure can last forever and might require continuous treatment.